going to talk about something a little bit different today. But given the pandemic, it seems pretty appropriate. So the COVID pandemic has really resulted in an unprecedented change in our routine. The repercussions of the global lifestyle changes that have been induced by the COVID-19 pandemic on the autism population are really largely unknown. Individuals with autism spectrum disorders often have increasing behavioral symptoms with changes in routine. So this is a major change in routine. And the question is, what effect has the pandemic had on children with moderate to severe autism in particular? During disasters and pandemics, it's well known that vulnerable populations are overly influenced and negatively impacted by these occurrences, but really little is known about what happens with children with autism. Pandemics really differ from other types of disasters in that they prevent victims from getting together. Instead, it's the opposite. There's separation, isolation, and quarantine. And this ends up with interference in the normal routines and rituals that generally protect us all and protect family functioning during crises. And this is especially relevant to the autism population, where repetitive behaviors and interests are a defining feature of the condition. And people with autism tend to like to adhere to relatively rigid daily rituals and schedules. The World Health Organization declared the COVID-19 outbreak caused by SARS-CoV-2 a pandemic in March of 2020. And shortly after that, the United States declared the pandemic a national emergency. Since then, there have been several fairly significant societal changes, including children having to stay home from schools as institutions around the country were closed. In California, this began in March of 2020, and many of the children that we see didn't really return to school in person until August or September of 2021. So well over a year when they did not have the physical, social interaction and educational interaction that they were used to. Staying at home and in most cases not attending school, that is not attending school in person, can create a relatively unique, stressful situation for children with autism and their families. Carefully developed routines get disrupted, support networks have in many cases disintegrated or at least gone down quite a lot. And parents have been asked to do a job that training teachers find challenging. And the parents haven't had any particular training in most cases in teaching their children the way a teacher would. These challenges happened abruptly, and the consequences could be particularly profound in the autism community. It's important, and we felt it was important to ask how COVID-19 was affecting the health of children and their families and what might be done in the future should a similar event arise. Now, there have been a number of reports in the medical literature over the past 18 months about the impact of COVID-19 on children and adults with autism and their caregivers. What has been found and reported is that there, as might be expected, and there's been an increase in demands on caregivers of autistic children and youth around the pandemic globally. And there have been reports from all around the world about this. One of the parents may have had to stay home in order to care for their children who would otherwise have been in school. And the studies have reported that parents have experienced an increase in stress and mental health related symptoms during lockdown measures. In a study from Qatar, 58 caregivers, a large number reported a significant increase in their care burden. Interestingly, 2/3 of those reported that the individuals they were caring for had either unchanged or improved behavior during social restrictions, not worsening behavior as one might have expected. But despite the fact that their behavior in many cases was improved, the caregivers had a marked increase in care burden and a tremendous amount of stress related to that. They also found that individuals with autism had reduced levels of aggression during the pandemic, which again is interesting in that one might have thought that might be the opposite with a change in routine. In another study in northern Italy, 94% of families had a challenging time with increased difficulties in managing daily activities. And in that study, children had more intense and more frequent behavioral problems in a fairly large percentage of cases. And a history of prior behavior problems predicted worsening behavior during the pandemic. So we see conflicting results in different studies about behavior of the children, certainly not conflicting about the stress and burden on the parents or caregivers, though. Another study in Portugal showed that there were changes in behavior in children with autism that included increased anxiety in both the children and the families compared to a control group of families without autistic children. A study in Michigan showed high increases in levels of stress in caregivers of younger children and in older individuals with autism spectrum disorder. So again, hitting both caregivers and individuals with autism. And then finally, another study from Turkey was quite detailed and showed that the majority of individuals with autism had problems understanding, these are more severely impaired individuals, had problems understanding what COVID-19 was and the measures that it required, such as mask wearing. They had challenges in implementing social distancing and hygiene-related regulations. The majority stopped receiving special education services. And the authors noted a pattern of increased stereotypies, aggression, hypersensitivity, behavior problems, and sleep and appetite changes. So across the board, worsening problems in all of those areas. They found that the children had a significantly fewer number of hours of sleep at night during the pandemic, and the anxiety levels of caregivers were high and correlated with the current behavior problems of the children and not the previous behavior problems. So in March of 2020, we were poised to start entering participants into a study of a clinical trial of the use of cannabidiol to treat problem behaviors in children with severe autism. That was right when the pandemic hit and everything closed down, so we did not actually begin entering participants until June of 2020, but realized that we really needed to find out what the effect of the pandemic was having on the children that we were including in the study, because this might alter the results of the study. And so we added a behavioral questionnaire called a Health Impact Survey, adapted for autism and related neurodevelopmental disorders. And parents were asked to complete the questionnaire at the beginning of the study. What I'm going to present to you is unpublished data yet. We are putting together a paper on this now, based on 40 children, and these are all boys, ages 7 to 14 years, who had very frequent daily behavior problems, including aggressive and self-injurious behaviors, frequent, repetitive, and pervasive stereotypies, and extreme hyperactivity. Their baseline educational status before the pandemic, 31 were in elementary school, 7 were in middle or high school, and 2 were homeschooled. 23 of the 40 were in a special ed classroom in a public school district, 7 in special ed in a non-public school, 8 in a general education program with support services, and 2 were homeschooled. Their baseline communication skills were varied. 9 were nonverbal, 9 used single words only to request things that they wanted. 12 were able to use short phrases, 3-word phrases at least, to request some of the things they wanted. And 10 were able to use longer phrases or sentences and to, in some instances, relate something that had happened. But what happened with COVID was that 90% of the children moved to homeschool. So almost all of them were no longer in their classrooms, they were in homeschool. 63% had their schoolwork using telehealth or teleeducation on Zoom, Skype, or phone conversations. 17% only received their educational materials through emails sent or mail sent to their homes. 14% received educational services through in-person appointments outside of the home, but not at school, but with another tutor or some other person. And 6% received services by a teacher or behavioralist or therapist going to their home. And of the 40 families, only 4 said that education and services had not been impacted due to COVID-19. And those were mostly, 2 were homeschooled already, and 2 had services set up so that the children were continuing to receive services during the pandemic. 2/3 of the children also lost access to additional educational and support services, including speech therapy, occupational therapy, and ABA. And when services were not lost, they were often modified to online interventions using Zoom or similar methods and not in person. And parents reported that this was very difficult, that the children really did not want to, children were not able to pay attention and do the therapy as they had when they were doing it in person. A small number of children had more difficulty adjusting to changes in daily routines during the pandemic than before. Only a few adjusted to daily routines well, and before and during the pandemic, that didn't change. But those who occasionally adjusted to routines before the pandemic, this is a blue, did not do as well during the pandemic and moved over to rarely or not at all being able to adjust to daily routines. So there was a small percentage of children who did have difficulty with adjusting to routines. Some of the interesting things were that 1/3 of the children spent more time watching TV and digital media such as YouTube during the pandemic. Almost none of the children had spent time on social media before the pandemic, and this didn't change. And half the children did not play video games at all prior to the pandemic. During the pandemic, 2 of those children began playing video games, and 4 others increased their time spent on those games. Sleep was affected less so than I actually thought it would be, but 28% had more difficulty getting to sleep during the pandemic. A very small percentage, 19%, slept fewer hours during the pandemic than they had before, unlike one of the previous reports that had shown a lot of sleep problems and getting fewer hours of sleep. And once asleep, the children were slightly less likely to awaken during the night. So 20% had less nighttime awakening, whereas 15% had more, and the rest, no change. So that wasn't terribly, sleep didn't seem to be terribly impacted, except for difficulty getting to sleep in about 28%. Self-injurious behaviors did increase during the pandemic. The percent of children with self-injurious behaviors before the pandemic was about 42%, and that jumped 10 percentage points to 52%, with children who had not had self-injurious behaviors before developing them during the pandemic. There was no indication that we found of any changes in adjusting to routines, to changes in routines, level of hyperactivity, anxiety, or aggressive behaviors or amount of and frequency of stereotypies or repetitive behaviors. And we did not find any effect of language ability or IQ on any of the variables that we examined. So what did we learn from this? Well, it appears that the vast majority of boys with moderate to severe autism in our study were negatively affected by the pandemic in some way. Their inability to attend school with peers and have in-person learning was certainly impacted at 90%. They lost ancillary services, and there was a loss of social interaction with their peers and other people outside the immediate family. Behavioral issues were more prominent during the pandemic, including self-injurious behaviors, and to a lesser extent, difficulty adjusting to changes in routine and difficulty getting to sleep. The change in routine led to more time spent on digital media, but little to no time in peer social interactions. The limitations of doing something like this are there are a number of them. Some of the questions were a little ambiguous, and parental responses may have differed because of that. The questionnaire was administered during the pandemic, and it asked questions about what the child was like pre-pandemic, 3 months before, as well as what they had been like in the last 4 weeks. But that relied on parental memory of what the child was like 3 months before. And certainly with kids changing all the time anyway, that could have skewed the results some. And the questions were addressing a number of areas, but might not have been focused enough to identify specific problems. Some of the parents' comments from the questionnaires, many of them commented that their child was unable to sit and focus for Zoom teaching, and a parent had to sit with a child in order for them to attend at all. So that a parent found themselves spending a large part of the day sitting with the child on at the computer or iPad, going just to keep them paying attention to the teacher, or helping them to do their homework or their schoolwork when it was sent home. And that certainly negatively impacted quality of life for everybody. Some of the examples of their parents' comments, concern I have is that since the structured environment changed academically, my child might fall even further behind in school. No social stability or access to extracurricular activities with peers. He loves school and misses his teachers. And these were very common threads. What's the long-term impact? Well, we don't know what the long-term impact is, but the comments as well as our data raise the question that there might be a long-term impact. While the short-term changes in behavior appeared relatively mild based on the questionnaire data, the long-term impact is more difficult to ascertain. The loss of school, therapy, and routine activities might have a longer-term impact on behavior, socialization, and learning, not reflected in the relatively short-term data presented. As we come out of this period and children are back in school, it's going to be really important to monitor them carefully for any indication of long-term effects. And these could include changes in their interest in school, changes in their interest in other activities, their willingness or ability to participate in social interactions with their peers and others outside the family, and the emergence or worsening of aggressive, self-injurious, or other problematic behaviors. And it might be important for schools, therapists, and parents to monitor for behavior changes and address and report those as they become apparent, so that issues can be addressed in a proactive manner if they are beginning to occur. And finally, parents need a well-deserved break for being teacher, therapist, and playmate, and go back to what they do best, being a parent. The pandemic has really made it clear that there's a need for public health and educational groups to plan for possible future pandemics and other kinds of disasters, with protocols for rapidly mobilizing additional resources to support caregivers. And this would hopefully enable them to look after themselves and their dependents with autism. Training of parents and caregivers in parent-administered home-based therapy for children with autism might be considered, especially to tide them over in the event of similar unexpected adverse scenarios. And proactive programs could be developed to teach adaptive coping skills to caregivers in the event of such an unexpected change happening in the future. Hopefully, we're not going to go through anything similar again, but if we do, we really need to be better prepared. I'm going to thank all of the families who participated in the study and who continue to participate in our study. And thank you for your attention.
Fascinating stuff, but why therefore does it seem to be at odds with some of the sources that I've been quoting? Perhaps they're different, perhaps they're limited, but the one I mentioned this morning and talked to earlier today and talked to John Hickey about as well, you get video games that online appear to be antisocial, you know, but there's a community called the Autcraft community, which uses Minecraft, the game, which says that it's helping children with autism learn social skills and build relationships. So, did you have any sense of the possibility that some of the social media or game playing might indeed be, never mind social media, but game playing might indeed be a useful technique?
Not in our population, no. And I think Dr. Smith-Hicks addressed that earlier when she said that it depends on what you're using the games for. If you're using it because it's fun and you want to share it with somebody, then it can be a social interaction. But if you're doing it as a fixation and an obsession, and it's only that and nothing else, and nobody else is involved in it, then it's not helping with social interactions. And our kids, remember, our kids that are in our study are on the more severe end of the spectrum, and for the most part are not using these kinds of games for any kind of social interaction. They don't play with other kids, they don't talk about it, they are really more fixated on it. Now, there are exceptions, but and I think, as she said earlier, people who are higher functioning may be able to use it for that purpose, but I didn't see that in our population.
Connie, did you have any thoughts on what you just heard from Doris? I'd be curious to know.
So we have seen similar challenges in our patients' population as a consequence of the pandemic. Certainly, the worsening behaviors is really common, not only across those who have intellectual challenges in addition to their autism, but those who were considered higher functioning, but also have mood disorders or anxiety that were previously relatively well medicated. And so the changes that came upon them as a consequence of the pandemic really did impact their behaviors. And you know, several individuals needed urgent or emergent care as a consequence. So the pandemic has really been challenging for many. There were a few whose parents found that the opportunity to spend time with their child was very beneficial because they were able to see how their child learns, and they'll be able to support them. And those are things that they didn't really have insight in. So I think there's been some pros and cons depending on the families. There have been some that had benefit from the experience and others that was really challenging. Another thing that we have experienced as a consequence of the pandemic is the challenge of making autism diagnosis in the young kids who were born during that period of the pandemic. And so, you know, it's a child who lives with just mom and dad. There are no other kids, right? And mom and dad might have been working and the child is there and trying to play, but their level of social engagement is not there. So that has created a new challenge for us as to how do we think about autism in that population. And many of the times what we have done is to say, we need to provide opportunities for social stimulation, and then we can revisit the question. But that's been one of the challenges that we have also seen.
Yeah, for both of you, I'm interested in going back to that comment I made early this morning when I read a little piece from Simon Baron-Cohen's book on the pattern seekers. And to see whether anything was learned during the pandemic, which obviously is a time of great focus, even if it might be an unpleasant focus, that could be prompted any thoughts that might shift the way in which education is conducted. I mean, he specifically is talking about how can we bring hyper-systematizing into education, and he's talking about imagining an educational system that offered two streams, a broad curriculum and a one for specialists, the hyper-systematizers. Is there anything in the behaviors that you noticed emerging, and Doris, that you talked about in your proposal there, that you think would be useful data, information to think about schooling, about education? I mean, I know you had some slides at the end there, but can you just elaborate on that a little bit? How you both think about teaching and whether something you learned from this ghastly business?
These are just observations at this point, but I think these are things that we already know, though, that children with autism do well in a structured setting, structured school setting. And one of the problems with, doing homeschooling is that it's not always able to be structured as well. And I think that this just reminds us that that there needs to be a lot of structure, and maybe that goes along with hyper-systematizing. But other than that, I have not seen anything that really would help with answering your question. In this study, I'm really focused on the study, not talking about any other studies or clinical work.
Yeah. Any thoughts, Connie, on that one? Or?
Yeah. So we certainly see a lot of children with autism who exhibit pattern-seeking behaviors and are considered hyper-systematizers. I think that the pattern seeker approach to learning might be something that will be useful to implement in, say, the middle or high school years, where we're beginning to think about the transition phase. How do kids transition out of school into work? And how can we build on their strengths to help them in that endeavor? I've seen many kids in clinic, and I remember one kid in particular, she drew this detailed dragon. And she did it in a matter of 30 minutes. There's no way I could do anything like that. Now, how can we capitalize on that skill set, right?
Where was the last time she saw a dragon or something?
I think she saw it in a book or something. Or maybe maybe it was maybe that movie, How to Train Your Dragon. I don't know, but there was no dragon in the clinic, no representation of a dragon in the clinic. So she was pulling it from her memory as she was drawing it. And she did it in a brief period of time. So I think, and one of the things I often tell the parents of my patients is that let's look at what they're good at, what are their strengths, and let's build on that to help them as we think about what happens when they, when school's done, what do they do next? And I think that's probably where we can really incorporate that pattern seeking ability. And it's going to vary with each child because, you know, like we said, they're all very different. And so everything needs to be tailored.
Yeah. There's a question, Doris, from Garrett Hoff. If Dr. Trauner's data was primarily through parental accounts, how do you think parental mediation of an autistic person's experience affects the data you collected? Is there any area that you would like to see your findings confirmed through different methodology? And if so, what would that methodology be?
These are observational questions. So this is what the parents are observing. They're not what the child is feeling, and it's not intended to suggest that this is what the child is feeling. Because most of these children are very limited in their either willingness or ability to communicate this kind of information to us. We have to rely at this point on observation and other people's observations and our own. I can certainly. There are other things that could be done to try to get at what the children are feeling more directly, or how they're responding to the pandemic more directly. And this would be something that would be wonderful to do. It's not included in our research, but what I would do if I could is one of the many things I would do is to have them draw pictures of what's going on now, to draw pictures of school, draw pictures of home, draw pictures of COVID, because they've all heard about COVID. And, you know, we can get some feeling for how they're responding to it that way. And also by doing some other nonverbal types of tasks that would be a more direct way of finding that out, Garrett. And I think you're absolutely right. I mean, we are limited in what we are able to do within the confines of the study that I'm doing. But in more general terms, there are other ways that we could go about finding out more about how the pandemic is affecting these children.
Yeah. This doesn't immediately flow, but it's something that I've been thinking about quite a bit, because we've been talking about lost touch in the other talks and connectivity and so on and so forth. And you're talking about how people feel when they're remote, and there's more imposition of solitude and so on and so forth. Do either of you have any comments on how music fits into this? And let me context that a little bit. One of the things that we have talked about before and have some interest in is the way in which Kelly Hunter uses Shakespeare, as you will recall, to teach kids on the spectrum and so on, largely because it brings a wonderful rhythm to their operation, because it's all iambic pentameter, de-dum, de-dum, de-dum. And there's also a lot of papers I've been looking at recently which talk about the impact of music on getting a whole audience's heartbeats in an orchestral setting in sync. This whole capacity to sync the heart, or to sync systems using music, seems immensely important. Is there anything that either of you have come across and worked with that speaks to this? It's not specifically on your point of your talk, but it just fascinates the heck out of me.
Well, I can say that that almost all the children that I see with on the spectrum love to listen to music, and it does seem to have a calming effect, and they have very specific likes and dislikes about what music they like and what music seems to calm them. And then on the other hand, there are some of the children who, if they hear a certain song, will become very agitated. So they have very specific likes and dislikes that, and it's all different. It's not the same music for everybody either. How we could harness that, not.
Well, let me ask another question, which is my sneaky way of getting to one of these questions from Sandy. Is there any research on sensitivity to sound, which shows that it's not the sound that's painful, but the memory that the sound is associated with that triggers painful memory?
Not that I'm aware of. That it's the memory of.
They can't be taken apart. Obviously, there's always It's a system, so that when you hear a sound, a memory is evoked, and your entire adaptive representational networks are firing. And
right. I'm not aware of any studies, but I can envision a way that one could probably do that by using representation of the sound, right? I imagine that even though there's no research that I'm aware of, I imagine that is indeed possible, because sounds, as Doris was alluding to, evoke emotions from us. And if the emotion is a negative one, right, then I imagine that it could channel responses, behavioral responses that signify that, the sound is aversive, or the memory of the sound is aversive. But I'm not aware of any research along those lines. I wanted to, however, tackle that question of music in individuals with autism. And I too see a similar pattern as Doris was reporting, that many children enjoy music and have their preferred music. Some of my patients, I can think of many of them who are musicians. They play an instrument. Yes. And I was reflecting on that as I was thinking about this whole concept of touch. And we can think that, you experience music through vibrations, which is part of our tactile processing system. And so while I am not aware of data that supports effectiveness of music intervention therapies, I think that might be a reasonable thing to explore.
Yeah.
But it would need to be done, certainly with scientific rigor. But that's, I remember a parent telling me that her child would use words when you sing to them. So, they're able to sing the happy birthday song or the whatever, but they otherwise wouldn't say happy birthday. And we that concept is not new, because we see it in patients with other focal neurodeficits, as opposed to the more global brain challenges that we see with autism.
Yeah, and where all this is going in terms of virtual reality and augmented reality, wearing those things, a metaverse, and so on and so forth, I really don't know. It may be generational that I wince at some of these ideas and still like the idea of touch and still like the idea of music, but we'll see. I find it hard to imagine those things kind of going out of fashion somehow, but who knows? And that was wonderful to have you both. Thanks for joining in, Connie. Thank you, Doris, for the work.